Welcome to Friday's edition of COVID-19. Authorities have recorded some 500 new cases over the past 24 hours and are renewing their calls for public vigilance as inoculation efforts continue nationwide. Speaking of inoculation, we touch upon plans for the third quarter later on in the program after a look at the pandemic updates. Now, having said that, I turn now to our Kwon Soa. Soa, tell us more.
All right, Sunny, we are heading into the weekend with COVID-19 infections in the 500s, slightly above 500, that is, with 507 infections reported as of 12 a.m. this Friday. With that, domestic transmissions have dropped to the high 400s, and we've got 23 cases from abroad. Now, the accumulated caseload in Korea, however, has surpassed 150,000 this Friday. And as infections have been hovering between the 300s and the 500s in the past week, the average in daily cases in the past week stands now in the 400s. Now, let's hope that these figures will stay positive or decline over the weekend, as health authorities are set to announce a social distancing system revision on Sunday, and with some regions having started to relax measures or have announced to do so. So let's go over to our map now to take a closer look where this is occurring. We've got here Gwangju with just 2 new infections here. Beginning this Friday, private gatherings of up to 8 people is now allowed, and also the same here in Jeollabuk-do province with 4 new infections here. Beginning on Monday, that same relaxed measure will be in effect. And let's take a look at the vaccination front. Of course, the relaxed social distancing measures are coming with higher numbers of inoculations. We've got now 14.2 million people in the country who have received at least 1 shot of COVID-19 vaccination. That's equivalent to 27.7% of the nation's population.
I see. Meanwhile, over in the UK, so I understand, a recent study there is advising people who survived COVID-19 to still seek vaccination amid variant concerns.
That's correct, Sunny. According to researchers at Oxford University, COVID-19 survivors still need to protect themselves with vaccination, as it reduces the risks of being reinfected, especially with other variant cases. So vaccines, say, provide stronger immune responses than natural infections. Now, meanwhile, variants in the UK, especially the Delta variant or B1617, is behind the surge of recent infections, with a daily caseload of over 10,000 recorded on Thursday, the highest figure in almost 4 months. Young people are said to be the main contributor to the spread of the highly contagious variant. In Brazil, COVID-19 related deaths are on the rise, back to the level they were 2 months ago, with the average daily fatality standing at around 2,500 in the past week. The total COVID-19 death toll is approaching 500,000. Vietnam, meanwhile, recorded its highest ever number of COVID-19 infections since the pandemic broke out last year, with 503 local infections confirmed on Thursday, many of those traced to outbreaks at industrial parks and a Christian mission cluster. Let's now take a look at the global figures as of noon Korea time. Brazil here at 17.7 million cases reported, over 74,000 new infections in the past 24 hours. And the UK has hit 4.6 million with, again, for the second straight day, over 10,000 new infections. And the total number of cases around the globe stands at 178.1 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, meanwhile, for more coverage of Korea's third quarter vaccination agenda, I have our Kim Sung-yeon here in the studio with me. Welcome, Sung-yeon.
Hello, good afternoon.
Now, before we delve into the actual plan, let's begin with the news about remarkable protection against COVID-19, even after a single dose.
Right, a single dose. Korea's health authorities did mention this in Thursday's afternoon government briefing, that AstraZeneca and Pfizer vaccines were 84% effective in protecting seniors aged 60 or older, even after just 1 shot. The KDCA analyzed more than 9.5 million people aged 60 or older, including 5.5 million who received the first dose of either the Pfizer or AstraZeneca COVID-19 vaccine. The AstraZeneca vaccine was 78.9% effective against COVID-19 after the passing of 2 weeks following inoculation, while the Pfizer vaccine was 86.6% effective.
Our analysis on the effectiveness of vaccines at 8 types of venues, including nursing homes where mass outbreaks have occurred, showed the vaccines were 100% effective in preventing death and 86.1% effective in preventing transmissions, including asymptomatic infections.
In fact, both AstraZeneca and Pfizer vaccines were 100% effective in preventing deaths from the novel coronavirus in people aged 60 or older. The data showed 109 deaths from nearly 5,000 COVID-19 cases in the unvaccinated group, but no fatalities were reported from the vaccinated people.
Wow, no losses of lives then. Well, having said that, let's now turn to our third quarter inoculation schedule.
Right. So, Sunny, basically, Korea will begin inoculating the younger population starting next month. So, in total, the country plans to vaccinate 22 million people between the ages of 18 and 59 in the third quarter, according to health authorities. Now, the KDCA announced its list of third quarter vaccine recipients with the goal of vaccinating 36 million people, or 70% of the nation's population, by September. Authorities will expand the vaccination program to age groups under 60 from July. Now, first and foremost, a total of 170,000 people who had vaccine appointments booked for June but were not able to get their shots due to supply issues, they will be the top priority group in July. High school seniors will be taking their college entrance exams later this year, and teachers under 30 at schools and daycare centers will also get their shots starting July. Meanwhile, people in their 50s are set to receive their first shots starting late July. And further breaking down that age group, people between 55 and 59 will get their vaccines on the last week of July, and those between 50 and 54 in the beginning of August. Now, those between the ages of 18 and 49 will be inoculated from mid-August and throughout September. This also includes autonomous vaccinations by regional authorities and workplaces. And come September, people in welfare blind spots, including disadvantaged senior citizens, people with serious disabilities, as well as the homeless, they will be receiving their vaccines.
I see. Now, I believe authorities have also granted the green light to cross-inoculation, Sung-yeon.
Right. Sunny, Korea's third quarter vaccination plan does include mix and match inoculations. The KDCA did say it will allow AstraZeneca and Pfizer vaccines to be combined in two-shot regimens starting next month as well. Now, some 760,000 people, including in-home caregivers aged over 30, medical workers at community health centers and pharmacies, as well as other essential personnel, such as police officers and firefighters, will be eligible for mix and match vaccines.
The delivery of 835,000 AstraZeneca doses from COVAX will be pushed back to a time later in July, so we believe it is necessary to allow the mixing and matching of vaccines rather than risk delaying the vaccination schedule.
According to the KDCA, this group received the AstraZeneca vaccine for their first dose in April and will receive Pfizer vaccines for their second dose after July 5th. Health authorities said mix and match vaccines, though, are strictly voluntary and will only be given to those who give their consent. This decision comes amid uncertainties in vaccine supply, with the delivery of 835,000 AstraZeneca doses from the COVAX facility being delayed from June to July. The KDCA said global studies on mix and match vaccines have revealed no safety issues, and some studies even suggest that combining different vaccines may even create higher antibody levels than receiving 2 doses of the same vaccine.
All right then, Sung-yeon, as always, thank you very much for that coverage.
Thank you for having me.
Right, we are poised now to join the regular briefing on the COVID-19 situation here in Korea for this Friday. And while we wait for that to start, let's take a look at the incentives for those who have received 1 dose of the COVID-19 vaccine and have witnessed the passing of 2 weeks. First, these individuals are excluded from the cap of 8 people for family gatherings. This means any family member who has received at least 1 dose at least 2 weeks prior will be exempted from the head count of 8 people for family events. The briefing is about to start. We'll come back to you afterwards.
Good afternoon, ladies and gentlemen. I am the head of the National Infectious Disease Research Center, and let us now begin our regular briefing for June 18th. First of all, on the vaccination front, as of today midnight, we have 412,987 more people receiving their first dose. And right now, the total number of first dose recipients stands at 14,233,045. And we also have more than 3,884,710 people being fully inoculated. First of all, I would like to extend my deepest appreciation to all of the members of the public for your participation in the inoculation drive. And my thanks also goes out to all of the medical workers and the public officials, as well as the volunteers who are making these inoculations possible. And next, as of the 15th of June, we have another round of the meeting for the compensation of the post-inoculation adverse responses. And in this third round of meeting, we have looked at the small scale of the compensations, which is below 300,000 Korean won. And we have looked at 183 cases which are subject to these compensations. And moreover, we have been looking at the correlation with these adverse responses with the vaccines. And as for the cases which have higher possibilities of other causes, we have deemed that these 40 cases were not subject to these compensations. And we have made possible that some 350 cases are subject to the compensation. And also there were cases that have been exempted from these compensations earlier due to a lack of documents and materials. And we also will be providing them with up to 10 million Korean won if they also develop severe symptoms after the inoculation. And we have looked at the 3 cases, and currently we are undergoing the compensation provision progress for these 3 people who have signed up. And as for the others who have applied, we will also look at these screening process going forward. And the quarantine authorities, in relation to these compensations for the adverse responses of post-inoculation adverse responses, we are expanding the scope of the subject of this compensation to not only include the severe symptoms, but also moderate symptoms. And we are also streamlining the process of application so that we are expanding the national duty to protect the people. And as for the post-inoculation the compensations, we are also providing these damages to those cases that are subject to these compensations based on international standards. And starting from in June, we have been expanding the number of meetings to about double the original, so that we are also speeding up the process. Moreover, if there are other symptoms and other adverse responses that are deemed to have be subject to such benefits and compensation, we will also provide them going forward. And as for these adverse responses, we will provide emergency aid as well as emergency welfare aid and all other incentives as well, so that we have no blind spots. And moreover, as for the Indian derived variant, we also have another variant, the Kappa variant, and we have been looking at the effectiveness of the South Korean homegrown therapeutics, and we have seen that this has been proved to be effective, and this has also helped the patients develop neutralizing agents, neutralizing antibodies, that is. And as for the Delta variant, we are also conducting our similar analysis, and once we have the details of that, we will also disclose them going forward. And as for the treatment, remdesivir has been administered to about 8,150 patients here in Korea, and the Rekinora treatment has been administered to about 4,900 patients here in South Korea. And also the blood plasma treatment, we have also approved 47 treatment cases that have been approved by the Ministry of Food and Drug Safety. And next off, we also have some research and data R&D aspects for our vaccine and therapeutics, and we also carried out our working level meeting. And as for the vaccine development, in in the latter half of this year, we aim to carry out our clinical trial as soon as possible, and we aim to develop the standards for these tests, and we also aim to provide a network together with the private sector as well. And moreover, as for the mRNA vaccine development, we are exerting our pan-government efforts and cooperation so that we are aiming to achieve these related clinical trials going forward. And as for the self-test kits that are currently utilized right now, and as for also the development of other protective gears, we are also discussing these related agenda as well. And last but not least, I would like to also note that globally, the COVID-19 outbreak has been seen a decline for the past 6 consecutive weeks. And here in South Korea, we are also speeding up our inoculation progress here in South Korea as well. And we also see that more than 25 billion doses of the vaccines have been rolled out. And right now, here in South Korea, we now stand at one of the top 20th countries that are rolling out the vaccines. However, by looking at each individual cases of these nations, the vaccination, the high amount of vaccination rate does not mean that they are containing the virus fully. Even though and this means that there are also countries that have also widespread of these cases, even despite the high vaccination rollout. And we are able to witness such symptoms and such phenomenon in the Middle East and also in some countries in Southeast Asia. And we also can attribute these reasons to the following reasons. And we believe that basically these countries have a very high infectious rates. And we also believe that these also countries need to have even higher rate of vaccines. And also second, there are also countries that have eased the social distancing rules too early. And also third, we also see these reasons as being the high spread of the new variants. And we believe that there are also blind spots as well. And fourth, we believe that there were some underlying problems or issues in relation to the vaccination drive in each of these countries. However, here in South Korea, we believe that we are going to see the effects of the vaccination rollout earlier than expected and more successful. And we believe that this is because relatively here in South Korea, the reproductive rate of the COVID-19 is relatively low compared to other countries. And we also believe that our social distancing measures are being carried out on a very rational level. And moreover, centering around the volunteer workers and public servants here in South Korea, we are also detailing our responses against the spread of the new variants. Nevertheless, we believe that the media also plays a big role in this aspect, and they are also ringing the alarm bell and also alarming that people need to take precautions as well. And all the way starting from the preventive measures to the vaccination drive, thank you very much for your participation in the government's drive. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 먼저.
Right, that was Kwon Ji-duk for Friday's afternoon briefing. So what did he have to say?
Well, it looks like Kwon has high expectations of the effects of the vaccination here in the country, and especially mentioning that here in Korea, people are practicing social distancing measures well, especially when it comes to the wearing of face masks. So with that, that's also important why we still have to wear those face masks, even though vaccination progress is speeding up. And he also had some mentioning on the government's compensation for people that have adverse responses after getting inoculated. So the government has decided to compensate 183 people for such adverse reactions. And they are still reviewing, though, whether there is a direct link to the vaccine and the post-inoculation responses.
I see. All right. So as always, thank you very much for that.
Thank you.
Right, in related news, telemedicine has been temporarily adopted here in the country amid efforts to curb the risk of COVID-19 transmission among those seeking medical attention for other conditions. I have our Chun Song-cho up next to share with us this virtual method of medical care. Hello, Song-cho.
Good afternoon, Sunny.
Right, so Song-cho, where are you taking us today?
Well, I'm at an office of a company that develops a telemedicine mobile application that people use to receive remote healthcare services from a doctor without stepping foot in their office. Well, physicians around the world are engaging in telemedicine these days, and currently it's available and it's legal in 29 OECD countries, the majority of them, including countries like France, the US, the UK, and also the South Korean government is stepping up its deregulation push for telemedicine, and it's currently allowing physicians and patients to communicate one another via phone call and video call for treatment and diagnosis. So let's talk to the CEO of this company to talk more about the services the company brings to both patients and physicians. 안녕하세요.
네, 안녕하세요.
So I'm going to ask him how he came about crafting this application. 어떻게 하다 이 어플을 만들게 되셨나요?
제가 지난 5년 정도 이제 원격 진료 약 배달 봉사를 이제 장애인분들한테 저희가 진행을 했었고요. 코로나로 인해서 가능하게 되자 저희가 전 국민을 위한 서비스로 이제 발전시켰습니다.
Alright, so he volunteered for 5 years to deliver the medicine to the disabled, and when he learned that these services are available or allowed in the government because of the COVID-19 pandemic, he decided to develop this application. And I'm going to ask him how the reaction from users has been so far. 사용자 그 반응이 어땠나요?
우선 한국에서 최초로 진행되었던 원격 진료 약 배달이었기 때문에 혼자 사시는 분들이나 아니면 약이 필요하신 분들에게 굉장히 많이 폭발적으로 사용하고 계십니다.
Alright, so since it's the first time in South Korea for these services to be available, it's especially popular amongst people who live alone or need medicine, who can't move. 그러면은 이거 어플리케이션 어떻게 사용되는지 한번 보여주실까요? 네. So enough of the talking is going to demonstrate how the application actually works. Alright, so first of all,
우선은 저희 앱을 까시고요.
Of course, you need to install the application in your smartphone.
그러면 여기에서 진료받고 싶은 항목들을 저희가 볼 수가 있습니다.
And here is a list of symptoms that you can choose depending on which symptoms you have, of course.
또는 진료 과목에 따라서도 이렇게 볼 수가 있고요.
And there's a separate list of specialties. So depending on which symptoms you have, you can click on, for instance, internal medicine or family medicine.
제가 감기 기운이 있어서 한번 진료를 받아보겠습니다.
So let's say he has a cold, symptoms of cold. So he clicked on this doctor.
그래서 의사의 리스트와 이제 진료비 같은 거 확인을 하고.
And here's the profile of the doctor, and there were what kind of treatments are available from this clinic.
증상을 입력하시게 되십니다.
And you type in which symptoms you have to make a request for the appointment. And you can also, you have to provide your personal information as well.
네, 그 다음에 이제 주민등록번호를 입력하시면.
So here's the part where you put in the private information. Also, you can upload pictures of your symptoms if the symptoms are visible.
네, 그러면 이제 의사에게 바로 진료 접수가 진행이 됩니다.
So he just made a request for an appointment to the doctor, and let's see if he's going to receive the request. He will do that.
의사선생님께서 진료 요청을 확인합니다.
Oh, and then he just verified the appointment.
그럼 보통 의사선생님께서 1분 내외로 바로 화상으로 진료를 시작을 해주십니다.
So usually he's going to make a call within 1 minute and process with the appointment. But because we are live right now, he's going to make the call himself.
네, 그럼 제가 직접 한번 전화를 걸어보겠습니다.
All right, so he's calling, making the video call.
방금 의사가 오히려 전화 주셨네요.
Oh, so he is actually calling him. All right, a little bit of a hiccup there. All right, so we are making that video call right now. And he's
네, 안녕하세요.
having a conversation with the patient.
네, 안녕하세요. 제가 어제 감기 기운이 있어가지고 진료를 받으려고 하는데요.
So he's saying that from yesterday he's having cold symptoms. He just asked what the symptoms are.
감기가 좀 있는 것 같고 콧물이 조금씩 나는 것 같습니다.
And he said he's having a running
약을
nose.
조금 먹어서 한 이틀, 3일 정도 먹어보면 코감기가 좀 나을 것 같습니다.
And he thinks a bit of medicine maybe will alleviate the symptoms.
일단 경구약 3일씩 처방해 드릴 테니까 경과를 좀 지켜보시고요. 3일 뒤에도 잔증상 있으면 한 번 더 재접수 부탁드립니다.
All right, so he's going to prescribe medicine for 3 days, and he will get back to him in 3 days later on. 이렇게 되는군요. 감사합니다. 오늘 이렇게 보여주셔서 네, 감사합니다. All right, so if you want the medicine to be delivered to your doorstep, then you can also do that with providing address and your personal information, or you can visit the pharmacy in person yourself and pick it up. So these services are available 365 days a year on a weekday, on the weekend, even on a public holiday. And it's getting extremely popular these days. As you can see, from February last year to May this year, there have been 2.04 million appointments made using this application. So you can see how popular it's getting in South Korea. It can be quite stressful to stay healthy in the middle of a pandemic between busy schedules and trying to avoid exposure to COVID-19. So hopefully these services will alleviate some of that stress from you. This has been Chun Song-cho, and back to you, Sunny, in the studio.
Right, Song-cho, that's quite convenient right there. All right, thank you very much for that coverage.
지난 2월 26일 예방접종을 시작하고 112일째 국민들께 말씀드렸던 상반기 내에 1,300만 명 접종 목표를 초과로 완료하였습니다. 3분기 중 2,200만 명 접종으로 9월 말까지는 누적해서 3,600만 명에 대한 1차 접종을 신속하게 완료하겠습니다.
As of noon this Friday, Korea has offered one shot of the COVID-19 vaccine to over 14 million people, well surpassing its initial goal of 13 million by the end of June. Authorities have also shared their third quarter inoculation plan. And for more on this, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And I also have Professor Sarah Ok-shin from Korea University. Good to see you again, Professor Shin.
Thank you for having me.
Right then, Professor Kim, the goal was to offer a dose of the vaccine to 13 million people by the 30th of June, but we secured the goal on the 15th of June. What made this possible?
Well, in late April, we noticed that we were out of vaccine supply, but now I feel joy because I can see the slope rising very fast, and now surpassed the 1/4 of our population. And it's still rising. Most of the developed countries with a sufficient vaccine supply showed a similar slope until they reached about 40 to 50%. So I think we're following the path, and our government needs to drive on that pattern. But as the global vaccination program proceeded, we have data from our front learners, and that tell us what should we care about the side effects and what to do, what happens. So I think obviously this helped our people to get more vaccinated because they have the right information, and obviously the incentives is working very good right now.
Right. And given this pace of vaccination, Professor Shin, what are your prospects on the goal of offering a dose of the vaccine to a total of 36 million people by September?
Well, I'm very hopeful that we can reach this final goal of having herd immunity in our country. We have very good infrastructure for vaccine distribution, and we have several lines of vaccines coming in. As long as the vaccine supplies are provided on time, I think we won't have any problems. So now we have, for this third quarter, we have 22 millions of people who need to be vaccinated. And these people belong to age groups of 18 to 59 years old. So they're more likely to be socially active, and many of them are working. So it'll be important for the government to offer the vaccine incentives, as Dr. Kim has mentioned. So we should allow, any of these people to be vaccinated. If they don't feel well after vaccination, they should have day off. And we should also, think about giving the exemptions of private gathering ban and outdoor mask wearing.
Right, like Professor Kim said, incentives.
Right.
Professor Kim, authorities have made public the gist of their third quarter inoculation plan. Now, do correct me if I'm wrong, but it seems as though the focus has shifted from priority inoculations to broader public inoculations. What are your thoughts?
Since the high-risk group, the elder group, is vaccinated somehow, I think it's wise to give opportunity to all, who is willing to get vaccinated as soon as possible. And maybe, as we saw the UK having a rise in the COVID-19 among young people, I think that's one of the factors. COVID-19 is like a long, dark tunnel, and before we got a vaccine, we tried not to enter this tunnel. But since we have this one, have vaccine, we should pass it quickly. So I don't think whether it'll work out as our government is planning. I don't know exactly, but definitely it's going to need some cooperation among people and the health officials, and definitely by the government.
Right, and talking about cooperation, Professor Shin, do you expect a continued strong public support for the country's vaccination drive, or do you believe we might witness a plateau in the near future?
Well, I hope that, we don't see a plateau. If you see other countries like UK or United States, once they hit like 40 to 50% of population having vaccinated, then they see a little bit of, plateau in the slope. And that's because, as Dr. Kim has mentioned, young people might be resistant of getting, maybe they don't have a sense of, getting this vaccination as a mandatory. I think our young people in our country has a very good understanding that, this vaccine is mandatory to end the pandemic. So I think we'll have a good, as long as vaccines are provided on time, I think we shouldn't have any plateau.
Right, hopefully.
Mm-hmm. Yeah, hopefully.
Professor Kim, what are your thoughts on plans to administer cross-inoculation with the Pfizer vaccine for those who've initially received the AstraZeneca vaccine?
Every time when we try to deal with these issues, decision is made by when we have a limited experience and limited research evidence. So this question has the same answer. But anyway, WHO is still having a conservative stance, telling evidence is insufficient. But there are situations that the second dose, we cannot have the second dose and should have a different kind of vaccine because they had a previous side effects and other supply issues. And when we look back, the previous vaccines such as pneumococcal vaccine or DPT or even Japanese bee encephalitis vaccines, there are situations we can cross other kinds of vaccines from different companies. And when we look at this COVID-19 outbreak, we know that the Russians developed a Sputnik 5. And actually, there's two kinds of viral vector using in one schedule. So that gives some evidence that we can use it like a mixed matching virus. We can call it heterologous vaccination, and it might result in synergistic effect or just an additive effect, or sometimes it might work out counterproductive, like showing more adverse effects like allergic reactions. So I think European countries already tried many trials, and recently we have a report from Spain, and all the trials include only a few hundreds of cases, so it's not big in number, but I think it's showing a promising result. So we have to wait for more, but I'm a little bit optimistic about this trial.
I see, so we can cautiously approach it. Professor Shin, as mentioned in our program earlier on by our Kim Sung-yeon, starting late July, authorities are looking to grant greater vaccination authority to local governments and even businesses that are on for 24 hours. What is behind this move, and what may be some of the risks involved?
Yeah, so I think they were considering regional differences and characteristics, so such as population densities, industrial structure, and perhaps the quarantine situations according to the regions. So, for example, if you're in a working environment where, in a factory where things are, they are producing 24/7, in a crowded area with no ventilations, then, these people, working people, should be a priority group to be vaccinated. And these decisions can be made by the local government if we give the authority to the local government. So it'll be essential for the local government to, carefully evaluate and decide, who's going to be the priority groups among for these third quarters of vaccination programs we have.
Right. Professor Kim, this is something Professor Shin mentioned earlier on, but a key variable perhaps in Korea's hopes to achieve herd immunity is the actual presence of adequate supplies. What are your thoughts on this?
There are a lot of issues. There were a lot of issues at the beginning of this vaccination program, such as cold chain, provide accurate information, and establishing vaccination centers or clinics, and motivating people. But the most important thing is supply. Our government has learned how to secure vaccine supply in recent months, and there is a lot of contingencies ahead in this pandemic. Like we might have a cluster outbreak, new variants might emerge, and also there are some political dynamics. So Korean government has to orchestrate through these hurdles, and I'm optimistic, but I think we have to achieve this goal before Chuseok.
Right. That would be late September then?
That's correct.
Professor Shin, the Novavax vaccine will be rolled out in the third quarter. What can you tell us about its efficacy and safety?
Yeah, so they recently reported the data from clinical trial 3, and they included about 30,000 participants from US and Mexico. And the overall efficacy was about 90%, and they had shown 100% protections against moderate or severe disease. Also, the Novavax vaccine showed highly effectiveness, 93.2%, at preventing the variants of COVID-19. So it's including Alpha variants from the UK and Beta variants from South Africa. So that's very positive news. And they also said that side effects were mostly mild. So it's really good news too. And they only had the pain and tenderness at the injection site. They didn't report any heart problems or rare blood clots. So I think it's a very optimistic results, and I hope that this positive note will continue with the real world results.
Right. And then on a more negative note then, Professor Kim, recently a man in his 30s lost his life after being confirmed with rare blood clotting following inoculation with the AstraZeneca vaccine. Now, as of now, the AstraZeneca vaccine is being administered to people between the ages of 30 and 60 here in Korea. Do you believe this age requirement needs to be adjusted again?
First of all, I would like to review about the EMA, European Medical Association, what they say. I mean, they say if you have a low platelet count within 3 weeks after AstraZeneca vaccination, you have to visit the specialist. And also, if you have an allergic reaction such as rapid swelling of face or lips or respiratory problem, also you have to see the doctor. And if there's a person who had this kind of phenomenon at the first vaccination, you should change to another kind of vaccine at the second shot. And when we look back the news, at March, Germany started to talk about these issues, and they prevented giving AstraZeneca age under 60, and then followed Canada. They prohibit if you are age under 55, and they say that if you're more younger, you might have a more high chance to get this kind of thrombocytopenic syndrome. And at May, UK started to say that they should give vaccination over 40. That means if you're 39 and under, you should not have AstraZeneca. When we look at the normal population, you have a cerebrovascular accident in about 1 out of 1 million. And after AstraZeneca vaccination, if you're under 40, it becomes about 10 times higher. And if you're under 30, it's even more higher. So still, I would say AstraZeneca vaccine is safe and beneficial. But if we have enough supply of alternative vaccination, we may have to consider giving other kind of vaccination if you're under 40.
I see. Right then, meanwhile, Professor Shin, what measures do you propose to ensure a safe vaccination process as authorities here seek to broaden the recipient base?
Yeah, so although it's not a large percentage in terms of numbers, we can perhaps think about countermeasures to prevent the recurrence through education of medical institutions, inspection of local governments, and also strengthening the standards for penalties or fines. So it is also a good way to make rehearsals mandatory for these medical institutions to frequently check the personnel and equipment from the local government, so depending on the situation.
Right, because we've had cases where wrong doses were given, wrong amounts of doses with the Janssen vaccine, right?
Right.
Professor Kim, do remind us about the prevention measures necessary to allow for herd immunity within the year.
Mm-hmm. Well, I think July is going to be more autonomy. We're going to need more autonomy and more responsibility. And I heard that there were some ideas that used a badge to show that you are vaccinated, but I don't think it's a good idea. Anyway, remember, you're not immune until 2 weeks past the final dose. Mm-hmm. And remember, vaccine is not 100% perfect. I mean, you might have a breakthrough infections. And I want to put emphasis on indoors activity. So avoid closed air circulation, like a air conditioning system in a closed circuit, and keep wearing mask and personal hygiene when you're staying indoors. Virus is created to mutate, so we're going to have a new variant. But anyway, if there's a new variant, you have to understand and find it out quickly and adjust to the new situation. So it is not finished until it is finished.
That is so true,
yep.
Which means remember to have your face masks on even after vaccination then for the time being. All right, Professor Kim, thank you so much for your thoughts. And Professor Shin, thank you very much for your thoughts as well.
Thank you.
Right, now while there appears to be a slight decline in our daily tallies in recent days, authorities are urging for public vigilance given the growing presence of untraceable infections. So do take care and see you on Monday.